My least favorite phrase, sports hernia. Sports hernia. I think the term sports hernia leads patients to have unnecessary surgery. In my opinion, there's no such thing as a sports hernia. About 50 to 70 years ago, somebody noticed that in athletes, they had pain in their groin after sports or while doing activities. And so they called it a sports hernia. And somehow general surgeons got a hold of this and decided, hey, we can fix these things. And there's dozens of publications and discussions and books written about this. But it's been a confusing diagnosis. The term athletic pubalgia came out. So an athlete, pain near the pubic bone. Then it evolved to osteitis pubis, which is inflammation of the bone on the pubic bone. And then finally, we've arrived at something called a core muscle injury, which is really the way I look at this problem. I see a lot of athletes, I'll see a lot of weekend warriors, a lot of people who do straight line activities. They run, they bike, they cycle, they row. They may or may not lift weights. They don't do a ton of rotational activities. And when it is time for them to rotate or pivot or move, they complain of pain in their groin. It could be above or below the pubic bone. It can be easily mistaken for a hernia. In fact, I do a lot of second opinion consults, and I would say somewhere between 20 and 30% of the times where I do second opinion, somebody gives me a classic story. I have pain when I play hockey or play soccer. It hurts when I get in and out of the car. It hurts when I roll over in bed. I don't feel a bulge. Those are the symptoms of a core muscle injury. And 20 to 30% of those patients are scheduled for surgery by a general surgeon thinking that they're going to help their patients. In my opinion, these are all core muscle injuries. They benefit from physical therapy or strength training or both, sort of a continuum. There's always an imbalance in the core, which results in additional strain on the rectus abdominis and the adductor muscles, and they're oftentimes just really pissed off. They're tender, they're sore, and it's really hard to do things. Oftentimes, if you're a professional athlete, if you're a high-level D1 athlete and you have this injury, you're not getting better with physical therapy. There are some centers across the country that might help you rehab a little bit faster than you could on your own. And then it's worthwhile seeing a specialist for it. But for 99% of the population, I'm not sure there's really much benefit.